get more physicians, even if you don't or you're unable to like dispense it or prescribe it, you at least know about it. So if someone asks you, then you'll be able to answer those questions effectively and with knowledge. So I see some people out there, some people have had the pellets. I am one of those people who I get pellets. And for me, my biggest reasons for doing the pellets was I was having mental fogginess. Um, I would be talking to people and couldn't come up with simple words. I would walk into a room, can't remember why I walked in there, have to go back out and I mean, it was just stressful. Fatigue, there's so many different symptoms that people experience and they're not sure why. And what a lot of people have been told, well, it's just menopause, this is natural, so this is just what you deal with. That's not the case for most men because they come out with Viagra, which is paid, by the way, by insurance companies. So my thing is that I want us to feel like ourselves, not like, because our 50s, 60s, 70s is not the same as what our parents' 50s and 60s were. Very different. And so we're much more active, we're much more involved, we're having kids later, which makes us have to be more active for a longer period of time. So things are different. Testosterone for women is not new. It's been around for over 80 years. It's something that we're starting to talk about just because of some of the information that has come out in the news. And so I'm going to dispel some things that are false, that a lot of us have been told, and that includes estrogen. I'm not opposed to prescribing estrogen. You need it. I'm not even opposed to prescribing synthetic estrogen. And we'll talk a little bit more about some of the studies that came out like years ago, which freaked everybody out and they didn't want to be on estrogen ever again because they were worried about breast cancer. Some of those things are misnomers and it's incorrect. So we're going to dispel some things, we'll answer some questions, kind of give you a breakdown of what it is. This is a back and forth conversation. If you have questions, ask me. I'll try to fill in everything that I know, and if I don't know, I'll make sure you get the information. But we do pellets, we do creams for women and men. Men can do testosterone injections that are actually covered by insurance, and I'm going to talk a little bit about men, even though they're not here, because their risk for other medical issues are significantly higher when their levels are really low. And so it's something that, you know, your spouse, your brother, your uncle, whoever, they should at least get tested, whether they do anything about it or not. So at least they know. So how many people have actually heard about bioidentical hormones? Okay. So some have heard of it, some have not. So we're going to go through all of it. So once again, women and men produce testosterone. Women and men produce estrogen. Women produce progesterone. So it is not that testosterone is only for men, estrogen is only for women. That's incorrect. Because when men are low on estrogen, and it's extremely low, the risk for certain things become higher. So what's the difference between bioidentical and the prescriptions that we prescribe that are synthetic? The only difference is that with bioidentical, it's plant-based, and the molecule looks just like what our regular molecule looks like. With synthetic, in order for it to be a prescription, it has to be something altered. Otherwise, it's not a prescription, and it's not a medicine. So that's the biggest difference, is that there is some change in a prescription molecule. So, symptoms. What do most people complain about? Not the libido, which is what most people think it is. It's actually fatigue. It's fatigue, it's joint pain, it is anxiety, it is mood irritability, it is the fogginess, It is the not sleeping at night. It is the hot flashes at night. Vaginal dryness. I could go, but there's a lot of symptoms that are associated with low testosterone. We think that it's strictly related to just menopause. Only thing menopause means is that your hormone levels have dropped low enough that it doesn't cause you to have a cycle anymore. That's what it means. Even in menopause, you still produce some hormones. The hormones just aren't high enough to have you have a cycle. What are symptoms for men? And then for women, there's weight gain, especially for men. You see the bigger abdomen. They don't want to do the things that they actually used to do. They're irritable. They have mood irritability as well. They're tired a lot. They have joint pain. So a lot of the same things do occur with men and women. So it is just being able to know where you are. How do you find out what your levels are? You got to get a test. And so there have been some places that produce the saliva test. I usually do more of blood tests, and I'm looking for your total and your free testosterone to see where those levels are. Ideally, we want you to be in a normal state in your 20s or 30s. So where that is at 20s and 30s, that's actually where we want to be when you're 40, 50, 60, 70. Because in your 20s, you feel awesome. You'll get a test, and it'll say, this is your normal range. Normal range, they'll have as low as 9 or 7, still in the normal range. And so when you have your doctor look at it, it's like, well, it's normal. Yeah, it's normal for someone who's menopausal, but that's not what you want to feel like. And so we want to try to get your levels in a range of what a 20, 30-year-old would be. And so that you feel like 20 or 30 years old. The goal of all of this is to make you feel like yourself, not like somebody you don't recognize. I've had people who they're like, this saved my marriage because I couldn't stand to hear him talk. I couldn't stand to hear him shoot. It has. I am one of those people. And a lot of it is, they're being sweet, they're wanting to be, intimate, they're wanting to be cut, and you don't want any parts of it. And so I'm not saying that you should get this strictly for the intimacy part. It actually makes you feel better. The fatigue isn't as bad. The memory loss isn't as bad. The irritability isn't as bad. And so you start to have normalcy again. The misnomer with estrogen, because it is a misnomer. So a lot of people are worried, if I take estrogen, that risk for breast cancer actually increases. So that study was, the people in that study, it was a nurses study, and those women had their uterus, and anytime someone has a uterus, and I tell people this, so if you're going to get estrogen from somewhere, your doctor's giving it to you, if it's your primary care doctor, if you have a uterus, you have to take progesterone. It has to be balanced, because if you are on unopposed estrogen, it changes the cells and it could cause overgrowth of cells in your uterus, which can increase your risk for uterine cancer. So that's the only thing I'm going to say as far as the progesterone and estrogen. But that study was women who were on synthetic progesterone and estrogen had the increased risk of breast cancer. It was not the synthetic estrogen alone. It was the estrogen and the synthetic progesterone. So even if you don't have a uterus and you are taking a prescription estrogen, your risk for breast cancer is not higher than someone else. It's only if you were taking synthetic progesterone and synthetic, that's when that risk increased. So it's a misnomer, because I've had a lot of people come in and they're like, I don't want estrogen because I don't want my risk for breast cancer to increase. It's not the estrogen. It was the synthetic progesterone. So that's one of the misnomers we're just gonna clear up. If you have a strong family history of breast cancer, Some people are a little leery about doing it, which is perfectly fine. I would say maybe about 60-70% of my patients who do the bioidentical don't do estrogen for one reason or the other, and that's okay. A lot of your symptoms will still be alleviated. So don't feel like if you don't get the estrogen, it's not going to be. I have for years only done testosterone. When certain things start to happen, if you're having more vaginal dryness, you're having more hot flashes all day long, those are then we start to talk about maybe adding a little bit of estrogen to kind of help with those symptoms. I don't know if we brought any examples. I wanted to kind of show you what a pellet looks like. So they're new packets, and so you can't really see. I don't know if Kathy may have an old picture of the pellets. Okay, it looks like about the size of a rice. It's really small. The procedure itself probably takes me about a minute to do. By the time I'm done, you're like, am I done? But I am a little bit more cautious because people will say, well, what are the side effects of estrogen? So with testosterone, all of this is going to be dose dependent. The higher the dose, the higher the chances of you having more side effects. I don't give women any dose that is anywhere near what I would give a man because you don't want to have a beard. I mean, there can be enlarged clitoris, so you don't really want that. So we try to be very cautious. I'm a little bit more conservative because I can always add. I cannot remove it once it's in. And it's because it is going to dissolve. Testosterone, pellets, and estrogen are made out of you. So it is a plant-based product. What I tell people, so when I usually do it, I'm a little bit more conservative, but I have you come back and we kind of see where you are. And if you're at a good place, then we leave you there. If I need to give you a boost, then we add the boost. Because once again, I cannot take it out. It'll go away in about 3 to 4 months, but I cannot take it out once it's in. So the procedure itself, again, and it's not painful. I am someone who doesn't necessarily like needles. So for me, a little bit more anxiety ridden just because I don't like needles. But truly, for people who have had it done, it is going to take me about a minute. We probably talk more about it, what to expect before I actually do it. And then by the time I'm done, you're like, is that it? So after you get pellets placed, what I tell people, you can't swim, you can't submerge in water at all. And the reason is because we don't want that to be disturbed. So no strenuous lower body exercising. And that's just for about 3 to 4 days. And then after that, you go back to your, what have I not touched? So, yes, you certainly can.
Okay, so where, I haven't read it enough, so you might have it in.
Where do I place them? So there are 4 options on either side of the abdomen or on the buttocks on either side. And so for men, I try to steer more towards the abdomen just because they don't have a lot of fat on the buttock area. But for women, there are 4 spots that you can put it in. Some women don't like it on their sides just because they don't want it. And it's a very tiny incision. It is an incision because I'm actually inserting it underneath the skin. It's smaller than the size of the pin. So it's a really small incision. But over the course of different symptoms start to go away at different times. It's not going to be one big boost and everything just magically disappears. It actually, I've had some people say they start to notice some changes in 2 days. I've had some people tell me it's 4 weeks. Everybody's a little different, and every symptom is going to be different. I didn't realize for a long time that it really did help my joint pain. So when I would get up in the morning after I'd gotten pellets, I didn't feel the ache. And so all those things start to improve. I have a couple patients who have rheumatoid disease, so arthritis. psoriasis, that they have joint pain, and when they actually get the pellets, their symptoms are better. So I'm not saying it's a magic pill. Still go see your rheumatologist. Don't stop your other medication, but it does truly help the symptoms. There's a sheet that's passing around. It's the one up. So I was trying to find the one for the women, but this is actually one for the men. And what it shows is at certain levels, things start to happen. This is one for men. I'll give you guys the one for the females. I couldn't find it today. But for those who have significant others, you can see erectile dysfunction, their hormone levels are 200. Heart disease, their levels are 600. So by the time they actually got to erectile dysfunction, it's a vascular issue for a lot of people. The vascular issue doesn't just stop with the penis, it's everywhere. And so the risk for heart disease is actually significantly higher after their levels drop to a certain level. Which is why I tell people, even if they should know, they should probably, just like if they go get their PSA checked, they should probably get their testosterone levels checked. And it's more so just to make sure that they aren't at an increased risk for other abnormalities. They've actually done new studies for men with prostate cancer. And they've actually shown that low testosterone increases their rate of prostate. And so they are now starting to, some of them are wait for a year, but if they've had prostate cancer and they are clear, they are actually able to take testosterone. Not synthetic, bioidentical, because there is a difference. So it's just things that people aren't aware of, because most men will think if they've had prostate cancer, they can't take testosterone. And that's not the case. They used to think that, but those studies have come out and they continue to come out. Once again, this isn't something that's new. It's been out for years. In Europe, this is something that's very common. Everybody is going to get their pellets. They are going to get their bioidentical hormones. It is a common practice. We live in, we're a capitalistic society, which is okay, but it is about medicine, and it is a stronghold on medicine. I'm not saying there's nothing wrong with medicine. We need it, but it's not a cure-all for everything. And if there's something that you could do that's a more natural process, we offer it. And it's just so that you have options. Question?
They don't submerge them into the water, but you take them how long?
3 to 4 days.
3 to 4 days.
3 to 4 days.
Are there any contraindications to getting it? Let's say you're a smoker, you have a history of uterine cancer or breast cancer.
Not for testosterone. So if you are a smoker, smokers actually have an increased risk of vascular disease. Estrogen affects the vascular. So I don't generally put someone who has and there are pros and cons of both of them. There are different stories. I haven't put anyone who has a higher risk of vascular disease on estrogen. I will put them on testosterone, but not the estrogen. Thank you.
So do you do a combination?
For a lot of people, yes. So I will do estrogen, I will do progesterone, and I will do testosterone. So even for those who don't have a uterus and they're on estrogen, if you don't sleep well, I will put you on progesterone. The reason is one of the side effects of bioidentical progesterone is it makes you sleepy. So in order for people who are having difficulty with sleeping at night, I will do a prescription for bioidentical progesterone. And a lot of times the pharmacists will carry it. Question? So any volunteers who have had, I'm not going to call anybody out, but any volunteers for people who have actually had it, you can certainly come up here with me and sit down and ask whatever questions that you like. So I'm going to just kind of go, because I probably forgot some of these things. These are just different little facts. So testosterone actually peaks in your 20s, and it declines by 50% by the time you're 40. And so that's why people start to have different issues starting around 40, because you're going to have about half of it by the time you reach that age. A lot of other things is that, and I've had 30-year-olds who their testosterone levels were really low, and they had really bad anxiety. And we had them on it for a couple of months, and I'm not going to ever tell you to stop taking your medication that was prescribed by you, but their symptoms were significantly better, even with the anxiety. They've actually shown in studies that estrogen, if you started 10 years before or 10 years after menopause, your risk for Alzheimer's and dementia is significant. It's about 70% less. And that is a newer study that just came out maybe within the last 5 years. So colon cancer is less. Bone disease is less. Estrogen affects your bone, affects your skin. So as we start to get older, skin changes start to happen. Estrogen actually affects that. And so the colon cancer, they've actually shown, like I said, there's no risk for breast cancer with women who are on bioidentical, even synthetic estrogen, as long as you're not on the synthetic progesterone.
So, I had a doctor who once told me that I couldn't take estrogen because, I've had blood clots. So is that, I don't know.
So the reason they say that is because estrogen does affect the blood vessels. And so, not in a negative way, but people get concerned when people have had some type of vascular event. I have put people, as long as it's not within a year's time, I have put people on testosterone. And a lot of symptoms actually do improve with just testosterone. Sometimes they actually overlap with what they're going to improve with estrogen and testosterone. Like I said, if you're having significant vaginal dryness, then you might need to have vaginal estrogen, or you do vaginal rejuvenation. But if you're doing hormones, the estrogen is going to work better.
What was the vaginal?
So it's a little different. It's a procedure that we do, and it is non-invasive, but it actually builds collagen, vascular tissue, nerve function, and it rejuvenates the tissue in the vagina, which also helps the bladder, because the bladder sits above the vagina naturally. So if you're having urinary urgency, frequency, it helps with those symptoms as well. The soluble estrogen in the vagina will help with a lot of bladder symptoms.
That sounds like
So, testosterone works with your muscle mass. It will help maintain muscle mass. Muscle will burn a little bit better, but I am not going to promote that it is a weight loss. It will help, but it is not necessarily a weight loss. You won't be as fatigued, so people work out more. And when you work out, your workouts are better because it's helping your muscle mass.
Is there any talk about any of this being covered at least for?
So we have seen such a wide array of coverage. When we first started doing it, we would actually build insurance, but we got so many different payment, non-payment for it that we stopped doing it. But what we did, some insurances will reimburse you for some of it. I've seen up to $100. I've seen as low as 10. It depends on the insurance. It depends on which type of insurance you have. So the Blue Cross has about 100 different types of plans. So it just all depends. We will give you the information of what the diagnosis code is, what you had done. We'll give you a receipt, and you can actually send it in to your insurance company. A lot of people will use their health savings account because you can use it for any medical purpose. So we have a lot of them.
I saw my doctor in January when I started hearing more about the hormone replacement therapy. So I brought it up to her. She never brought it up to me, and she's a OBGYN, never brought up this health issue that all of us women have. And so she finally agreed. So I'm taking the patch of estrogen now. I asked her about testosterone. She said, no, that, it's not FDA approved. Well, my understanding, it is FDA approved for men, of course, because they did studies for men, but not women. And I asked her, I said, are you on the estrogen patch too? She said, oh, well, I was for 5 years. I said, you're not now? She said, no, you cannot be on it for more than 5 years. I don't think that's true. Am I right? Wouldn't we want to be on that the rest of our life?
You are correct. Once again, I tell people, we were not taught this. And
Yeah, I
that,
don't think yeah.
and so, if you don't do your own research, if you don't go out, which is why we're trying to actually, have physicians, especially OB/GYN, because they're gonna be the ones who actually get asked these questions. And even if you don't prescribe it, you should know about it. And so, yes, when they first started doing estrogen replacement, the thought was, yes, so you can only be on it for 5 years, and after that, you need to come off. When you come off of estrogen suddenly, your risk for heart disease is even higher.
Really?
Yes. So if you're gonna come off of it, it needs to be a gradual process. Because when you suddenly stop it, your risk for heart disease, so heart disease is probably the #1 cause of death in women. People don't realize, they think it's breast cancer. It's heart disease. And so you have to, and once again, everybody doesn't keep up with all the studies that comes out. But no, if you're gonna stop it, you don't have to stop it. But if you're going to stop it, you should come off of it gradually.
Is there a reason people would stop it, or is the whole idea we should stay on it as long as we live?
So for some people, it's financial. For some people, the insurances, depending on the insurance, some of them I've seen where they will only cover permanent. It depends on the insurance. And so, yes, I have 70 and 80-year-olds who are on the bioidentical replacement. But once again, I'm not even opposed to the prescription, the synthetic estrogen. You just can't take the synthetic estrogen and the progesterone that's synthetic. You can take a bioidentical progesterone, but not a synthetic. That is where they have the risk for breast cancer. So yes, and once again, I know she's an OB. we weren't taught this. It's not something that, and I know it firsthand. I kind of, like I said, we've probably been doing it for about 10 years. And the reason I started was because it was almost like a fluke. Someone asked me, and one of my patients asked me about it, and I started looking at it. And I was like, oh, let me look into it a little bit more. And then I happened to go out of town with my husband, and we went to Indianapolis. And one of their friends was on it, and she was talking about it. And then when I got home, like the following week, there was a flyer at my house, which none of that ever comes to my house, for bioidentical. It was a seminar. So I went, learned some things, and then started doing my own research. And we've been doing it ever since. But once again, it's not new. It's been around for a really long time. In Texas, in California, they do this. Midwest, we're a little slower to it, but we're trying to make sure whether you decide to do it or not. That's up to you. That's a personal choice. But what I tell people, at least you know, because I've had people who have come and they're like, well, my doctor just said you just have to live with it. This is just what life is. But it's not like that for for men.
Right.
And if you're giving them Viagra, well, who are they having sexually? Because you don't really. So it is, we're trying to play catch up. And really it is about your total health. Your sexuality is a part of your total health. And it's not just about that. You feel like you're not as tired. That mental fogginess can be awful. If you're talking to people, they think something's wrong with you. And so it is stressful when you're going through those type of changes and nobody can tell you what's going on because you think something's wrong and you want answers. And so I'm not judging any other position. I understand why. I understand the reasons. Part of my goal is to educate not just patients, but also the physicians that the patients are seeing.
So I think you may have said something, but I was reading. So backing up, when you say that when you have a hysterectomy, that you should have been on estrogen?
So there are different hysterectomies. You can just remove the uterus and leave your ovaries. So your hormones come from your ovaries. So you can have a hysterectomy and not go through menopause because your ovaries are still functioning. When you take out the ovaries, it is a surgical menopause.
I went straight to the with the ovaries.
So you had your ovaries retained, you kept your ovaries. And so sometimes, depending on how, there can be decreased blood flow to the ovaries, which will also make them a little compromised. But the average age of menopause in the U.S. is 51. Some people are a little earlier, some people are a little later. Everybody's a little different. I'm 55. I just stopped. So, and I've had some people who they were 45. And so everybody's a little different. I do tell people that, and these are just an aside, you need to be on vitamin D. Because if you are not on vitamin D, when you go through menopause, estrogen is protective of your bones. When you go through menopause, you no longer have that same protection. And so vitamin D is going to help your metabolism, it is going to help your fatigue, and it is going to help your bones. And vitamin D with K2 because it actually helps to absorb it. With K2. Vitamin K.
It's just not seeing
It hasn't always, it hasn't always been. It's been a more recent that they have found that adding that actually helps the absorption of the vitamin D. Because most of the time we get our vitamin D from the sun, but we're not outside like we used to. So we have to get it from somewhere.
Okay. So you said to take vitamin D with K2. I always thought it was with calcium. No?
So we've cut back with the calcium. And the reason is that we saw people were taking too much calcium. And they were starting to get kidney stones. They were starting to get gallstones. So they started to kind of bring it back. And probably now instead of the calcium, with the vitamin.
Take it with K2.
With K2. And they come as a combination.
K2 and D3 together.
Okay.
It's a liquid version.
And if you just can't take it orally, you give injections. So, just can't take it orally, we do give vitamin D. So we give you 50,000 units. And depending on where your levels are, we try to get you up to, ideally, we want you to be around 50, 60, ideally. Normal is 30 to 100. But we want you to kind of be more in the mid-range or 60, 70.
So if you inject, how soon will you just come back on nothing?
So it depends on where your levels are. If you're low, we'll do it weekly. for about anywhere from 5 to 10 weeks, depending on how low you are.
So
To
once
get
they
you to a
get
norm.
there, once they get there, you're saying it's safe. Or
No,
it's all
not unless
safe.
you continue to take it. So then we try to take 20,000 per week.
Okay.
Yeah, so once you've gotten to a normal range, we have you take about 20,000 per week.
If you're taking a multivitamin, should you still take a separate vitamin D and vitamin K?
It depends on what's in your multivitamin, but most of them do not have enough. So I'm big on people reading the labels. So you know exactly what it is you are taking. Even with food, read the labels. So you'd be surprised of what's in the stuff that we are consuming. But I've seen vitamin D in multivitamins that was 500 units. I've seen it where it was 1,000. They're all a little different.
Yeah.
So it just depends on which one you're taking. But ultimately, you should be at 20,000 per week.
20,000.
If you're low, we put you on 50,000 to get you back to a normal base, and that's usually will be about 2 weeks, and then take you off.
Do you have any patients that complain about vertigo? And then,
Yeah.
like, if I had it like 2 years ago, and I feel like it won't completely go away. I don't have the room spinning anymore, but I have times where I was doing something and all of a sudden I kind of feel a little funny. Sometimes when I bend over and try to stand up, I feel a little dizzy. I don't like that.
Now, well, that can be a risk for you. I still tell people, want to make sure that there's nothing else that's causing it. It's not a magic pill, it's not going to cure everything, but I have had people who had it, their symptoms were a little bit better. But can't guarantee that that's going to completely go away.
I'm a patient.
Come on, sit up here. You're not the only one.
Okay.
Okay.
I've had the pellets, I want to say maybe like 40 years, at least 40 years, both my husband and I. And I recommend it to everyone. And to the point where it's not covered by insurance, but I try to get my coins up. So that, because there was a time period actually in that I did let it lapse. And I was like, oh, we can't do that again. That it was definitely, I mean, sleeping through the night, the fatigue, the fogginess, it has made a world of difference. And so both me and my husband, we've just determined that this is something that we are going to invest in ourselves to make us a happy human.
You know what I tell people though? I have some people who will go get Starbucks every day.
Yeah.
Yes.
Yeah.
And when you add that amount that you
Yeah.
spend on Starbucks,
Yeah. I mean,
wait,
yeah. No, like it's at the point now where like he'll know, I'm like, okay, you're coming up. Let's and he'll tell me like, oh, you got your money for Dr. Terry? Because it's so yes. And I will say Dr. Terry she's been my doctor she's delivered all of my babies. And I have a 16-year-old. So
don't tell my.
I'm just but I will say she gives you all of the information, any concerns that you could have, she monitors you throughout the process. Like if I were to go down this road with any physician, it would be Dr. Terry because she, yes, keeps you very well informed and monitors your progress. And we'll get on you. So, yes.
It's all about being healthy. And nobody, I mean, when people are in pain, when people are depressed, it's awful. It's an awful feeling. And so if there are things that we can share with them, we can give information that people know that there are options out there that might help them. It's just about making sure they have the information to do that.
The anxiety is a real one too. I didn't think about that. I just thought, oh, this is just me, but yes, it's makes a world of difference.
And I will say, the older I got, the more anxious I got.
Mhm.
I would worry about everything, like the kids going to the store. It was like,
Yes, yes.
and so there is a lot that your hormones do, even thyroid levels, and that's another subject. And when you get your thyroid level, make sure your doctor is doing a whole thyroid panel. A lot of times we only do one test, which is a TSH, but if you have antibodies to your thyroid, that may not show up in the TSH. So I try to have people make sure that they actually do the whole panel, so you know exactly what all of the thyroid levels are. Because that can also contribute to a lot of these same symptoms. So if you're tired, if you're having thinning hair, if you're cold all the time, those things can be related to thyroid levels. And so the older we get, the higher the chances of thyroids being inflamed.
So with this balance, so this is a rest of your life.
That's up to you.
You're not
Some
gonna
people
feel
who
better
they're-
go back to now.
You
So-
you don't
so-
want it.
So here's what I tell people as well. A lot of it too, with how we age, has to do with our diet. And so if we're changing a lot of those things in the process, you might feel better on your own without having to do this forever. Stress plays a role. I mean, a lot of us have high stressful situations, whether it's taking care of parents or kids or jobs or whatever that is, that's going to affect your hormone levels. So if you move to Hawaii and you may not need this.
That's why you're here.
Right, right. So, I mean, the goal of really, why we even opened the wellness center is that we were trying to make a difference in people's life. And so we talk about lifestyle changes. And I don't, when people come in and get their, I don't just talk about pellets. I ask generally how everything else is going.
She's
in
all
your-
in your
in your-
business. As you should be. I appreciate it.
And I'll get my opinion.
Yes,
I'm not saying
yes.
that about my opinion. But it is about trying to make people
Because that means people trust you more when you get here.
well, and I want to, and I don't always follow my opinion, but it is about making sure people have the information. Because if you don't know, then there's nothing that you can change. But if you know, then that's different. Questions?
Good stuff.
You can be.
Thank you. Thank you.
We probably have over 300 people who are on pellets. Some patients actually do. So how do you give? How do you give? You can do pellets. You can do creams. If you're doing a cream, you have to do it every day. A lot of times I will tell people to either put it on their inner thighs or on the labia. You have to make sure you wash your hands really well because it's topical. So if you have young kids, if you have pets, you can spread it because it's topical. So I just tell people to be very cautious if you're doing creams. There are some that you can put under the tongue that dissolve. They're called troches. Most people don't like to do it. Some people do. I'm not a fan of injections for women because it shoots your levels up really high, and you have to do it weekly. So you'll go up really high, and you'll drop really low. And we don't have a whole lot of wiggle room. Men, so the dosing that I do for women, it will range anything from 100 to 162 for women. For men, it usually ranges from anywhere from 1,600 to 2,400. So I can't give you anywhere close to what I would give a man. Men normally get theirs every 6 months. Women normally get them every 3 months because I have to give you smaller doses more frequently. The more active you are, but once again, they're natural. So they will metabolize, they will dissolve, and they will burn. And so, but if you do feel like yourself, And once again, yes, I have some people who have been doing it for years. And sometimes people will come off with them for a while. And if they start to feel like, I mean, we try to put you on a schedule so that we'll at least call you and let you know. Every 3 months for women, every 6 months for men, because people will forget. And then they'll get back into before they got the patterns. And then they're tired of it. And then they're irritable again. And they're like, what is wrong with me? I haven't had the balance. So once again, I'm not saying it's a miracle drug, but it's a miracle drug. Do you guys have questions? So side effects. Gonna talk about side effects? Okay. Some of the side effects, once again, I said it's dose dependent. So the testosterone side effects can be increased facial hair, chest hair, male pattern balding, enlarged clitoris, deepened voice, but it is dose dependent, which is why I'm more conservative, because I can always add it and not take it out. So I would rather have you come in twice and add more than to give you too much and you got a bill. So, and so we try to be too lazy, but I'm not trying to give you so much that you have to come in so much. I'm not trying to do that. So, with estrogen, some people can, if you have your uterus, sometimes you may start to have some spotting. When you first take it, that's a possibility. If you still have your uterus, sometimes you can have some breast tenderness when you first start. That it goes away. And so what I tell people is that those can be some of the side effects. With progesterone, I've already talked about that one of the side effects makes you sleep. So for some people, I give it for that reason because it actually helps them sleep. What was I going to say? So those are the biggest side effects. If you are you like your dose, you don't like the side effects, there are things we can also give you. There's something called DIM. It's a supplement that you can do, so it counterbalances when testosterone breaks down, the part that actually causes the hair. So it will prevent that from occurring. There's also a prescription I can give you called spironolactone. And that can help with, maybe good for acne, but it will help decrease hair growth as well on the face, not on your head. So those are things that we can also do. Because I've had some people like, I got to stay on these dose. What can we do? And so those are things that we give you options for. What else? I think that's all as far as the information that we have. But I gave everybody information. It is just so you have it, so you know what it is, how it works. If it is something, if everybody is different, there is no one dose for everybody. Everybody, and sometimes we have to change the dose depending on what you're going through. I've had people lose a significant amount of weight. We have to change their dose. So there is no one dose fits all. It's catered more towards you. Everybody's not on progesterone and estrogen and testosterone. Some people are just on testosterone. Some people are on both. Some people are on all three. Everybody's different.
Dr. Terry, just real quick, you had someone on Instagram who commented and said, Dr. Terry is knowledgeable and a fantastic professional. Exclamation point.
Thank you. Whoever that was. Thank you.
I'm sorry, last_Rima1.
Quick question. So I went to see a nurse practitioner who I found on like menopause.org, and she's on a certain certification for being, well versed in menopause and HRT. So I went to her, and I'm on the estrogen patch, and I was asking her about testosterone, and she told me, no, I think that the estrogen is fine for you. It's something you'll probably be on for the rest of your life, but she advised me not to go on testosterone. So
Did she tell you why and what? So it really depends on what your symptoms.
Yeah, I think she just said, for your symptoms, what you're describing to me, estradiol is really fine for you. I don't really see the point of you doing testosterone, but as we're sitting here, like my sister will tell you, I am always tired. And you're saying that testosterone would be good for fatigue, right?
So it is. What I always do is I want to see where your levels are.
And,
So
and,
if you're-
and they don't check that, but I insisted. Yeah, yeah. So I insisted, and they were very low.
Yeah, and so if you're really low, it probably will make a difference for you. But once again, it's just not something that people are taught. We are taught medicine in the US. And so it is, I'm a medical physician, I know medication, but I also know natural products. Because you have to give people, and everything is not gonna be great for everybody. But depending on what you're going through, and what your symptoms are, what your levels are, will determine whether or not you're a candidate or whether or not this is an option for you.
Thank you.
That's good, because a lot of doctors won't even look at natural options. They just, it's like, no, you take this pill, and I've had them tell me you have to take a pill, but I'm like, no, I'm not. I'm not doing that. You know, I mean, because it's just not, I'll figure out something. Yeah.
So when I tell you, there is a place for medicine.
Right.
I'm not gonna say it's not. And if you are a medical doctor, DOs are a little different. But if you are a medical doctor, this is what you are taught. You are not taught a lot of natural options. In that 2 weeks, we talked about acupuncture. We talked about bioidentical creams. We talked about, and this is a while ago, but it was a 2-week period. And that was it out of 4 years. And so you don't do it in residency. It's just not what we're taught. And so we want to be able to at least educate physicians who are going to, because people are going out and they're doing their own research. And so you have to know, even if you don't want to prescribe, you have to know what it is. You have to know what to discuss with clients when they come in. You can't just say, don't do it, if you don't know why you're saying, don't do it. If you have a reason, that's one thing. But if you're just saying it because you don't know, that's different.
Yeah.
And so we have to educate ourselves as a group, because the patients are going out and educating themselves.
Right.
And so we have to be able to have a conversation about all of it. And then let your patients make the decision. We're there to help you make a decision.
One of the reasons me and my sister started researching all of this was because our mother is 87 years old, and her whole life changed probably 12 years ago when she fell because she has osteoporosis. And had estrogen and testosterone been available to her back then, when that really bad Women's Initiative health study came out, she may have had a different kind of a life. Like she had all these fractures in her back, uses a walker, had to move out of her home, and she was like 70 when that happened, or 75. It changed her whole life. And I think number one reason with this estrogen and testosterone is to keep our bones healthy. That's a really big thing, I think, for all of us. And it's a shame that us women don't know enough about this. And I commend you, Dr. Terry, for helping us learn and learn about this.
And it is, so all my friends are on it. So, because it does change your life, and it changes your perspective, and it changes, like, I was older when I had kids, and so I was tired. And so just being able to stay active, being able to work out, although I haven't worked in a while, but those things actually help. And more so, the mental clarity. It's a big deal. And so when that starts to fade, that's concerning for a lot of people. And like I said, they actually, like over the last 5 years, and hopefully most of the, especially the OB-GYNs know about these studies, is that they have shown that dementia and Alzheimer, if you started within a 10-year period of going through menopause, your rate for that decreased by almost 7%. So it's a huge deal. But we just have to be able to get the information out and the correct information. Because there have been such a fear of estrogen for such a long time. But people don't understand what the study actually was. So it's just making sure people have the right information.
So Doc, for me, I don't know about most people, but the getting hot process, I found out who is puke on until I put out. That little bit of that's so got me hot so bad. Going to get you hot like this.
You probably should have had it tonight. Probably should have had it tonight.
I shouldn't have.
So I will tell people to get hot flashes. Spicy food, caffeine, and chocolate has caffeine. So whether it's coffee, tea, chocolate, power drink, however you get it, alcohol, spicy foods, high sugar is going to make your hot flashes worse. Now, I tell patients, that's up to you. If you feel like you need the caffeine to keep you going, which it is a false sense of energy.
Right.
But if you feel like you need it, okay. But that comes along with it. And so if you're okay with it, it's not gonna harm you. It may make you feel bad, but it is one of the side effects.
Right. So my second part was, I know we can't really tell based on what the medication somebody might be on, but there are a lot of women out here now doing the Ozempics and the semaglutides and all of that. How does this work with that? Or does it have any effect as causing issues on your
It does. And if you are on the Ozempic, because we do it, no, I'm just saying in general, for anybody who's on it who's considered it, it is a medication. And so there are ways to take the medication. You can't eat anything you want to eat and be on that medication because people become very ill. That's how it works. It makes you more nauseated when you're doing high sugar, high carbs. So I tell people, because we do, but I tell people before you take this medication, because once it's in your system for at least 10 days. You can't decide on day 5, well, I'm gonna go get all these donuts. You will be sick. And I have had people who maybe didn't believe what I was saying, and it will make you sick. The other thing is that you have to increase your protein intake when you are on those medications, because if you don't, you will lose muscle mass. The purpose of the medication is it will cause you to feel full faster, so your appetite is less. And then it's also, the negative side effect is if you eat a bunch of carbs and sugar, you're gonna be sick. So then it makes your mind think, well, if I eat this, I'm gonna be sick. So after a while, you don't want it because it gives you a negative side effect. But there are ways to take the medication. You just have to be careful. Okay.
Dr. Underscore Rima also said, pellets positively altered the trajectory of my menopausal journey. I credit Dr. Terry for her guidance.
We are all in this together. I have experiences, so it's not like I'm talking from experience. So I know how it feels. I know what it takes. It's not just one thing. I talk about exercising. I talk about what you're eating. I talk about sleeping. I talk about managing stress. As I talk about exercising. Hey, Rhonda. So Rhonda does it. So Rhonda's our trainer. for the fitness gym. So if you need a fitness instructor, I was going to her too. She will get you together. But we have to maintain our muscles, we have to maintain our joints, we have to maintain our mind, because we are living longer. Because the medication makes you live longer, not necessarily better. So to give you another 10 or 15 years and you're miserable, that's a decision that you all have to make.
How did we start? We call you off.
We will draw your labs here and we send them through insurance. So we will, there's a lab sheet, so in case you don't want to come here and get them drawn, you can go to your lab and have them drawn. If you're gonna get your labs drawn, we'll book an appointment, so we do a consultation. Because once again, I need to know what your symptoms are, what bothers you, so then we know how to address that. And then based on what your labs are, what your symptoms are, then we decide the dosing.
Doctor, with insurance, how long between the last full of labs, if you've had like a full panel, can you then, or can we sign over you getting access to those?
Yeah.
Just to start, if
Yeah.
you miss one or two of
Yeah.
them.
So normally, if it's within like a 3 to 4 month period, we'll use those labs. But routinely, if you're getting a full panel, they're not checking your testosterone. Unless you ask for it. You have to ask for it. You want to come up here and sit?
While she's coming up there, do you recommend the OBGYN that, to start helping out?
What,
Recommended it to use the OBGYN to educate them and help them out.
we actually are going to do a seminar for practitioners. Just because they don't know. And it's not like they are purposely trying to steer you in a different direction. They don't know. And so there are lots of studies that have been done. We have all the studies. And so it is a matter of educating. Just like we're trying to educate our patients, we're trying to educate our OB/GYN community as well.
So I'm a patient of Dr. Terry's, and so are my girls. She delivered my girls.
I see them now.
We've been talking a long time about doing it, and my boss back there has been doing pellets, and she's the one that got me into it, and then they came to you. I will tell you, they are a life changer. They make a world of difference. I do all three. It helps me sleep, helps my joints. I also do the cryo freeze here too, because that helps too. But she talks you through every part of the process. I was scared to death. I thought it was going to hurt. And she even realized as we were talking, I stopped talking and she's like, we're done. And I'm like, wait, what? And she's like, we're done. We're all done. I was waiting for the pain, and she was already putting the Band-Aid on me. I didn't feel anything. It was done. So if anybody has any questions or anything, do it. It's a life changer.
If you decide you don't want to continue to do it, you don't have to continue to do it. It will wear off. But if you are suffering, you don't have to. That's the one thing. Yeah. And
we
people
talk
will.
about it
People
for a long
suffer for a
time.
long time.
It's a game changer.
So thank you. You're welcome.
And Dr. you may have answered this, but so how long after you got the pellets did you begin to feel the difference? Was it immediate or?
I started feeling symptoms within 2 days. My symptoms was the tenderness, like just being rough. Everything was tender. But I started sleeping better right away because I do the progesterone. I was sleeping like a baby. And I'm usually one that has to watch TV to fall asleep and be awake. And I take my pill and within 15, 20 minutes I'm out.
Yeah.
That's it. But, yeah.
And different symptoms will start to happen and improve at different times. Like I say, it won't be everything at one time.
Yeah.
And you probably weren't really even aware of the joint until, yeah. And
And
it's like,
yeah, it's like no knee pain.
you just happen to get up in the morning and it's like,
Yeah, something doesn't hurt anymore. Yeah, and weight loss, started losing weight, gradually, not like immediate, but I've got maybe 10, 15 pounds. And I'm just starting my third cycle. So, that's all.
So what pills were you taking the night you were asleep? That's a separate.
No, she's got me on the progesterone.
Oh, I see.
So I do all three, the estrogen, testosterone,
Okay.
and the progesterone.
So the progesterone is a pill.
It's a pill, it's a pill. You take every night
So
before bed.
testosterone and estrogen are in those.
The tablets, yeah.
And then that one is, got it.
they have progesterone pellets. They don't work as well as the oil. So they even have cream for progesterone. It just doesn't work as well as the oil. For those, I don't know if everybody knows, so for those who are already patients and clients, if you referred someone and they came tonight and they start doing them, you get a discount for each person who signs up to do them, and the person who is new gets, right, you get $50 off of the consult and the first insertion. And it's just so that if you're kind of on the fence and you're, so the consults are 150. And the pellets are 400 for women. They are 800 for men.
That's every 3 months.
Everything.
And so the console is cost, and not credit toward first one or anything like that, right? Like,
Correct. And like I said, I have people who they use their health savings account. Because you can use it towards none.
The labs, we would do them here?
You can. It's up to you.
Okay, and then if we don't do them here, we have to submit it.
If you don't do them here, then wherever you go, you give them your insurance information and they'll submit it.
Yeah.
Like some people go to Quest or they'll go to LabCorp.
But you give us the order, is that it?
Right, so we'll give you the order
Here.
here. Yeah.
I had my labs done in January, and I did get the estradiol and testosterone done as well.
Okay.
But since then, I'm on the patch, so would I need to rerun both of them again?
So I still like to see where you are.
Oh, where I am right
Before
now?
you- Right.
And you're like, oh, yeah, so you might look at those, but I
Right.
need to know how much estradiol.
Like I said, if it's like a 4-month period, then we can still use those. But if it's been 6 months or then yeah, it's just to kind of see where you are. And so your hormone levels for estrogen are going to be lower. The only reason why they're lower is because you're on an external estrogen. So it makes your body not produce it. So it's a little different. But I take a look at all of it so that I can actually see kind of where you're starting. So if you ended up doing the pellets, I can see where your baseline is and then where you are after we've actually giving you the testosterone. And you can do, if you're on the patch, I'd probably have you still use the patch for maybe a week and then come off. Because we don't want you on a lot of estrogen or
You'll be getting patch once I'm doing pellets, but for 1 week.
Yeah.
Oh, okay.
just so that you're not suddenly off of it.
So then we just call your office to schedule a consult.
We scheduled it today. We already. So,
Okay,
And then also, the special will run for 30 days. Like if somebody does not schedule tonight, we're gonna give you 30 days in order to take advantage of this, and I would say, please take advantage of it, because you really don't always do it. I am a pellet survivor. So, next week, he said, I'm off the money
just want to say really quickly. Just really quickly, Dr. Terry is amazing. Right. She provides information like this every second Tuesday of the month. And we go live. And so if you're not following us on social media, please do, because every second Tuesday, she's either talking about a spa service or a medical treatment that she does. And you can ask questions online, and so you know it's not scripted. Because, I mean, when you have a script, it's not the same. But she's asked, like you did tonight, she's answering your questions online. So, share it, let people know, follow us, Facebook, Instagram, YouTube, Twitter, follow us. So that way you can get the information, and it's free. So,
What's your handle on Instagram?
oh yeah, that's
Okay.
Thank you for calling me out.
Don,
What's wrong?
call you.
Yes, I do know Dr.
Oh,
Dr. Paul.
You all seem like you got the same vibe. Thank you.
But thank you guys. I know it's Thursday. Some of you will have to go to work. I gotta go to work tomorrow. But, once again, you don't have to be miserable. If you are miserable, there are things that can be done. If you know people who are miserable and you're like, you need to go somewhere, tell them. Because like I said, a lot of people don't know that this is even an option. But there are things that can be done. And like I said, my biggest thing is to make sure you have the information. What you decide to do with the information after that is out of my hands, but at least I have given the information. So thank you. Yes,
So I do know that it's in care credit, right?
we do.
It's in care credit. Well, have you all ever thought about, I think I talked about the Alpheon? Alpheon is another card that you can use for cosmetic surgery or cosmetic or whatever, right?
Okay.
So that's another one, just to
What's
make.
the other one that we use? What is it, charity? Yeah. So, yeah, they're a little bit more forgiving than care credit.
I just wanted to know, so if you do want to schedule tonight and you're gonna get your labs drawn here, which we do use the insurance to do that, I'll get you signed up, but if you need to take the lab to your own doctor, we can get you signed up for it.
Okay. And then if we're giving you a lab sheet, we will schedule you only because when you get those labs, I'm responsible. And so I need to know what those labs are. Because if you have something abnormal and I don't know, I'm ultimately responsible.
So let me ask you this, with Asia, you got to live well now, and all of your tests are on there. Would that be, could you see that, or you want?
So what we have people do is we have them screenshot.
Okay.
And so, yeah, so you can screenshot it and then email it to us.
Okay.
And we'll give you the email. We'll give you the email that you. Questions, anyone? Comments? Thank you guys for coming out. I usually do this once a year. I might do it